Today, we're going to tackle one of the biggest promises in modern medicine, this idea of using big data to build a future with better healthcare that somehow also costs less. Let's dive right in. This is the one question that pretty much every single healthcare system on the planet is wrestling with. Can we actually improve how we care for patients while also making the whole thing financially sustainable? It really sounds impossible, doesn't it? And this slide just nails that central conflict. Every single hospital is walking this tightrope. On one side, you have the moral imperative to deliver the absolute best care possible, and on the other, you've got this relentless pressure to stop costs from just spiraling out of control. And look, this isn't just some business school problem, it's a very human one that affects every single one of us. Now this is where it gets really, really interesting. There's a huge trust gap. We're constantly told that data is the answer, right? But the source material points to this staggering fact. Only 20% of healthcare executives, just 1 in 5, fully trust the data they're using to make decisions. So what you have is this massive crisis of confidence that's holding the whole system back. So what's really going on here?
Well, that brings us right to our first section. We've got to understand this balancing act a little better and really pinpoint the specific pressures that are forcing everyone to search for a new solution.
It's so important to get that rising costs aren't just one thing, it's more like a perfect storm. You've got avoidable readmissions that just drain resources. You have expensive equipment that's underused while your staff is completely overworked and burning out. Delays in diagnosis mean more expensive, last-minute emergency treatments. And the whole thing is made so much worse by these fragmented systems where critical data is just stuck in silos, totally unable to talk to each other.
But what if there was a prescription for this crisis? This is where the hero of our story comes in, big data analytics. And let's be clear, this isn't just about collecting more and more information. It's about finding the hidden stories and the powerful insights that are already buried in the data that hospitals have right now.
So what are we really talking about here? Well, put simply, big data analytics is the whole process of taking all this messy, complex health data. We're talking electronic medical records, lab results, even data from your smartwatch, and using these advanced tools to turn it from just noise into clear, actionable intelligence.
And this whole process has what you could call 3 superpowers. It all starts with descriptive analytics, which basically tells us what already happened in the past. But the real magic? That begins with predictive analytics, which starts to forecast what might happen next. And that leads us to the ultimate goal, prescriptive analytics, which actually recommends the best thing to do. So you see, it's a journey from just looking in the rearview mirror to actively grabbing the wheel and steering into the future.
Let's really focus on that second superpower for a second, because it's a total game changer. We are talking about a fundamental shift in medicine, moving away from constantly reacting to emergencies and toward proactively planning for what's coming.
Just imagine this for a second. Algorithms can now spot these super subtle signs of a patient getting worse, sometimes hours before their vital signs even change. That gives doctors a huge head start. Or they can analyze dozens of factors to predict which patients are most likely to be readmitted, letting care teams step in before another crisis happens.
And this just scales up to the entire system. Hospitals can start forecasting their staffing needs based on, say, seasonal flu trends, or even get ahead of disease outbreaks in the community. This lets them get supplies and beds ready, making the whole system way more resilient. And just to be super clear, this isn't some abstract data science happening in a lab somewhere. These complex predictions get translated into simple, easy-to-read dashboards. This puts actionable intelligence right into the hands of the doctors and nurses on the floor, helping them make smarter, faster decisions in the moment.
Which brings us right to the payoff. Okay, we've seen what this tech can do, but what are the real, tangible rewards? Let's look at the key benefits that directly answer that big tightrope question we started with.
And this illustrates the impact beautifully. We're seeing high-impact results all over the place. Major cost reduction, dramatically improved patient outcomes, and much, much smarter use of resources. Let's break down those first 2.
Okay, first, the cost side. By analyzing patient records, analytics can flag duplicate tests, which saves both money and time. It can pinpoint the most effective treatment pathways for specific groups of patients. And by helping doctors intervene earlier, it cuts down on those incredibly expensive emergency room visits. And even more importantly, the impact on patient care. AI-powered alerts can speed up a diagnosis. All this genetic and historical data allows for truly personalized treatment plans.
And these predictive models are completely changing how we manage chronic diseases, basically keeping people healthier for longer.
Of course, if this was all so easy, everyone would already be doing it. We have to acknowledge the real-world hurdles, because that's the only way to understand how we can actually make this a reality for everyone.
The first challenge is a huge one: privacy. Patient data is incredibly sensitive, and all those strict privacy laws, like HIPAA in the US or GDPR in Europe, they're completely non-negotiable. The solution here really is in the technology, things like strong encryption, anonymizing data whenever possible, and super strict role-based access so only the right people can see specific information.
Next up, you've got the problem that a lot of hospitals are still running on older, siloed systems. But the answer isn't to just rip everything out and start from scratch. Instead, things like interoperability frameworks can act like a translator between the old and new systems, while data lakes can pull all the information together without messing up existing workflows.
Then you have the human element, which kind of brings us back to that trust gap we talked about earlier. You need people who actually understand this stuff. The solution here is really twofold. You can partner with outside experts who have the skills you need, and you can invest in training your own teams on user-friendly platforms. That way, you empower everyone to act on the insights and, build that confidence in the data.
And finally, no hospital can do this alone. It's just too big. Strategic partnerships are absolutely key. Collaborating with tech vendors and joining these big data collaboratives allows organizations to share what works, learn from each other, and scale these solutions way faster and smarter.
When it's all said and done, it comes down to this really powerful idea from the source material. This isn't just about efficiency or saving a few bucks. At its heart, using data to make better, faster decisions is fundamentally about saving lives.
And that leaves us with one last, really crucial question. The technology, the data, it's all here, right now. The potential is absolutely undeniable. The only question left is, are our healthcare systems actually ready to listen to what that data is telling us?